interest into the ethics and professionalism of healthcare providers and trust in the doctor-patient relationship. Sudharshini is also a medical doctor with MD in community medicine and works as a faculty in Madras Medical College, Chennai, India, and she teaches the undergraduate and postgraduate medical and paramedical students, and her areas of interest include health system research using an aquatic lens. Rajeswaran Thiagesan is a physiotherapist with a master's in public health. He's pursuing his PhD at the Gandhigram Rural Institute. He works as a research, monitoring, and evaluation lead in an NGO called REACH, Tuberculosis Care and Control, involved in monitoring and evaluation in public health, followed by Sudharshini, who will give us an illustrative case study example of an M&E project. And finally, Vijay will explain about the ethical issues involved in monitoring and evaluation. And then finally, we have a question and answer session. I would advise everyone to please mute your mics while our presenters are present. Thank you. Over to you, Rajeswaran.
Thank you, ma'am. Thank you so much to the South Asian Bioethics community for this wonderful opportunity. Special thanks to Dr. Vijay. May I project my screen and share the presentation?
Yes, please.
Is my screen visible, ma'am?
Yes.
Thank you. So good evening all. So we'll be seeing briefly about the methods involved in monitoring and evaluation in public health. We'll light touch on the basics and then move forward. So this is how I have planned this session. One will see the basic, what do we mean by monitoring? What do we mean by evaluation and the difference between monitoring and evaluation? And then we'll progress on to principles of monitoring and evaluation. What are the advantages of M&E? And finally, an M&E framework. So monitoring and evaluation is basically checking how well a public health program or a public health policy is working in order to promote, protect the health of the people and prevent disease. And mainly choosing on monitoring, it is nothing but keeping a close watch on what is happening. It is basically based on a regular collection of data from various public health programs, and it is categorized into inputs, processes, outputs, and outcomes. And then regular monitoring helps us to identify early detection of issues and also to act them to improve the outcomes and also mid-course correction. Evaluation is an assessment to see how well a public health intervention has worked or how well the public health intervention has made an impact of the desired outcome of the program. An evaluation mainly focuses on whether did the plan work and did it leave a positive impact on the target population. So the difference between monitoring and evaluation. So I broadly categorize into three, that is the purpose, frequency, and changes. So monitoring, it is the purpose of doing a monitoring is mainly to track the progress of the program, identify various issues, correct them, and keep the public health intervention on track. Whereas the purpose of evaluation is to do a comprehensive assessment of the program to understand its impact or effect on the community. The frequency of conducting a monitoring is, it is a continuous process. It is ongoing, like there are no fixed intervals. So it is ongoing process and happens throughout the program from start to the end. And it involves frequent and continuous collection of data on a real-time basis. The data is analyzed to come to conclusions and make mid-course corrections. Whereas evaluation happens at periodic predefined intervals. It may happen towards the end of the program or generally at three levels, that is baseline evaluation, midline evaluation, and endline evaluation. The monitoring helps in changing day-to-day amendments in the program or day-to-day activities of the program to make it better and to make it in a simple way to speed up the process, whereas evaluation helps to change a broader strategic decisions and also policy changes which would have a direct impact on the health of the community. So there are five processes which encompasses monitoring and evaluation together. That is inputs, process, output, outcomes, and impact. So in these five steps, the first three, that is inputs, process, and output, belongs to the monitoring component, whereas measuring the outcome and the impact goes back to the evaluation component. So there are some 7 to 8 key principles of monitoring and evaluation. The first and foremost is the relevance. So whenever we design a monitoring and evaluation framework, it should always be aligned towards the overall goals of the program and the objectives of the program. And by meaning objectives, monitoring and evaluation also takes care of the financial component also and not necessarily program alone. Second, the credibility of the M&E findings. So whenever we complete a monitoring and evaluation, the findings must be valid and reliable. Third, transparency process. So the methods or the process of how we are going to do a monitoring and evaluation and also the results of the monitoring and evaluation must be accessible to the core team which had called for the M&E process. Second, the constitute of an M&E team, they should be impartial and they should be bias free whenever they conduct a monitoring and evaluation. And the M&E process must be participatory, wherein all the stakeholders of the program, like even it may be government partners, NGO partners, community partners, or field level community, it has to be a participatory approach. And utility, whatever the findings or the outcomes of the M&E, it must be an actionable outcome. And the process of M&E must be cost effective. So whenever we plan or design an M&E framework, the cost-effective method should be chosen always in order to reduce the burden on resources. And finally, adaptability. So the M&E, since it's a continuous process, it must be able to adapt itself to the changing context and needs of the program, because some activities might be added, some activities might be excluded. So all those things should be taken into consideration whenever an M&E program is designed. So it should be adaptable as per the needs of the program. So advantages of performing a regular monitoring and evaluation. First and foremost is improved decision making based on real-time data. So this can happen immediately after a monitoring visit or after conducting a midline evaluation or as and when the M&E is planned according to the program requirements. Second, it improves the accountability of the program implementers and also the other stakeholders to the community, because any public health program is accountable to the government or to the funders, or at the least it's accountable to the community. So whenever we perform an M&E, it brings in the component of accountability to the implementation part. Third, it prevents the wastage of resources and optimizes resource utilization. This is because whenever monitoring and evaluation is done, the problems are identified at the earliest so that we ensure the efforts are not wasted in that particular focus and it is rerouted towards the objectives and goals of the program. Third, evidence-based planning and policy making and also learning what works. So whenever an M&E is conducted, as I said, it must be valid and reliable so that it forms a part of evidence and which gives a document or which gives us an understanding of what works and what does not works. Next, evidence of impact and therefore possibility of a scale-up. This is largely a component of an evaluation wherein if we are doing an impact evaluation, then if it is going to be a positive one or negative one, whatever it may be, if it is a positive one, there is a high possibility of scale-up given a robust...
That's me.
Hello?
Yeah,
Ma'am,
we
am I
can hear
audible?
you. Right? Yes,
Okay.
yes. Yeah.
Next, evidence for sustaining programs. There are certain components in a public health program or the entire program So certain programs are targeted based on sustainability. So creating an evidence and documenting it is also a part of M&E. And last, timely corrective action for problems and issues that are identified. So this forms the basis for monitoring. That's why it is done on a routine basis for early detection of problems and course correction actions. So one of the key frameworks which is used across is the logical framework approach. So there are 4 to 5 components which forms the part of a logical framework approach. That is, based on the goals, we devise the objectives, and based on the objectives, we devise the indicators. So for every indicator, we develop and demonstrate a numerator and a denominator, followed by how are we going to verify this data, or how are we going to verify this process, and what are the assumptions to give to those conclusions. So these 5 are the core components of a logical framework approach, which is a widely used M&E framework in public health. Thank you.
Thank you, Rajeswaran, for that presentation where you highlighted the key principles of M&E and its advantages, and also briefly giving us the M&E framework. Now we move to Sudharshini, where she will give us a illustrative example, a case study of M&E in public health. So over to you, Sudharshini.
Hello, hi. Thank you very much for the opportunity given. I'll try to share the screen.
Yeah.
Screen visible, ma'am?
Yes, Sudharshini. Can you put it on slideshow? Yeah.
Yeah. So once again, thank you for the opportunity given. So I will be presenting to you on a case study example of how monitoring and evaluation of a project in public health is done, and I'm going to take the example of a project called as Makkalai Thedi Maruthuvam, which is a flagship scheme in Tamil Nadu. Before even going into the monitoring and evaluation aspects that has been taken for evaluating the project, I would brief on what is the project and why this project even was implemented in the state. So as you see, Tamil Nadu, which is the southernmost state of India, looking at the global burden of disease, we were able to see huge, epidemiological transition from communicable disease to non-communicable disease being taking the most of the burden of the disease in Tamil Nadu. Hence, it was a felt need that something has to be done with regards to diabetes and hypertension and other non-communicable disease in the state. So, Tamil Nadu Health Systems Reforms Project is one among the various projects which is done in the state of Tamil Nadu. This is a World Bank, loaned project, wherein there are many key interventions that are being planned as part of this project. One of the key intervention that is part of this project is to increase the share of adults with hypertension or diabetes whose blood pressure or blood sugar are under control. So this project is basically a disbursement linked indicator, wherein if we are achieving certain goals and targets, we would be able to get the loan given by World Bank. So as part of this project, first step that was done was a step survey was implemented to understand what is the actual burden of the disease and what is the proportion of people with diabetes and hypertension under control. And based on that as a baseline, there should be a percentage point increase in the share of hypertensive under control and diabetes under control over a period of 5 years. And also to endorse initiative which are from the list of evidence-based interventions, and to also have a look at the process evaluation of this program, which is Makkalai Thedi Maruthuvam. So as per the STEPS survey, it was found out in Tamil Nadu, 33.9% were hypertensive, among whom 7.3% of the hypertensives had their BP under control. So now the target is to improve from 7.3% to 10% of hypertensives to have the BP under control. Similarly, in diabetes, as per the STEP survey which was done in the year 2020, 17% of the diabetes, 17% was the diabetes proportion prevalence in Tamil Nadu, and among them, 10.8% had their blood sugars under control. Now the target is to increase from 10.8% to 17%. So to achieve this, one of the initiative that was done by the state of Tamil Nadu is Makkalai Thedi Marutvam, which is nothing but a comprehensive community-based and an institution-based intervention, wherein we are trying to deliver the services of screening and providing drugs to the patients at their doorstep. So if you look at this part of the slide, you will see what are the various interventions that are given under this Makkalai Thedi Marutvam scheme. Henceforth, we will be calling it as MTM scheme. So one of the intervention is population-based intervention. One of the intervention is screening of hypertension and diabetes at the doorstep, providing home-based physiotherapy services, home-based palliative care services, and screening for symptoms of COPD and CKD, and providing CAPD bags for CKD patients. So these are the various services that are provided at the community, at the doorstep, by the field workers. So who are the team that are involved in the field? So women health volunteers, village health nurses, palliative care nurses, physiotherapists, mid-level healthcare providers, health inspectors are the field team workers who would be providing the services, community-based intervention services in the field. And MTM is not just providing services at the doorstep, but also providing services at the institution. So also providing services at the institution through NCD clinic, wherein the services would be provided by the MTM staff nurses who are trained on certain NCDs. So basically they'll be trained on screening for diabetes and hypertension, screening for common carcinomas, and they would be linking those persons who are identified to be suspected diabetes or hypertension to the doctors. So this is the, overall scheme of MTM services. So as Rajeswaran was mentioning, these are the input, process, output, and outcome and impact of the MTM services. So the input for MTM services would be manpower. So there are, we can understand that there are different levels of manpower, human resources involved in delivering the services, and equipment requirement for MTM. Again, at the field level, there are different sets of equipments that are required, which has to be calibrated, because the entire program is based on the equipment. So we should have a proper calibrated BP machine. We should have a proper calibrated glucometer to say whether the person is diabetic or hypertensive, and also to further refer them to the hospitals for getting themselves diagnosed. And the third thing is having drugs. So, the program also involves giving distribution of drugs at the field level. So the process includes appointment of women health volunteers and NCD staff nurse, training the women health volunteers and the staff nurse. Also training the women health volunteers and NCD staff nurse on screening for diabetes and hypertension. And it is not just having the drugs and equipment at the state level, but also distributing to the field. And from the field, it has to go to the women health volunteers. So here, the women health volunteers are not actually healthcare providers. They are part of a different program wherein they are part of a self-help group under Women and Child Development Program. So they would be trained for screening for diabetes, hypertension, and other carcinomas, and they are provided only honorarium. So screening, output includes screening coverage for diabetes, hypertension, cancer, and number of people who have been diagnosed among who have been suspected, number who have been initiated on treatment. So the final outcome would be what is the proportion of diabetes and hypertension under control, proportion of people with cancer on treatment, and the final impact would be the amount of number of deaths that have been reduced because of NCD. So let me take you through the monitoring mechanisms that the program has in itself, the inbuilt monitoring mechanisms that the program has. So for the scheme as such, there is a portal called as MTM portal, wherein all the stakeholders involved, the field workers as well as the institution-based institutions, have to feed in on the beneficiary list. I mean, whoever is attending the program. Yeah.
मैं बताता कि important meeting पे हल्दी है सही है मैं कहूँ फायदा है मेरे कमरे में पानी यही.
So the MTM portal gives a list of people who have been.
मैं कहूँ फायदा है मेरे कमरे में आला ही सही है ना.
Gives a list of beneficiaries who have attended the services through MTM, and this is also linked with something called as population health registry, which is again unique to the state of Tamil Nadu, wherein the already existing family registers are made into e-registers. So anybody who is coming to a different institution, he is diagnosed to have diabetes or hypertension or has been screened as part of this program, they would be linked to the PHR. So a person coming to Madras Medical College to get services for diabetes or hypertension, they would be entered in the MTM portal, which is again linked to the population health registry. So if the person is belonging to some other HSE, say for example, if he is coming from Medavakam, and by linking with this VHR, the VHN of the subcenter will get to know about this person's status. So the population health registry is linked with the MTM portal, and apart from this, they have their electronic reporting, using the Excel and the Google Sheet. And apart from this, there is also a Government of India application which gets details on the non-communicable diseases. So these portals are being used by the administrator to look at what is the number of people who had been screened, what is the proportion who had been diagnosed with diabetes or hypertension, proportion on treatment for the same. So apart from this, reviews are being conducted. So at field, there is someone called as an NCD district program officer who visits the women health volunteers and village health nurse in the field on, they have a fixed tour program. Based on the fixed tour program, the NCD program officer visits the WHV and the women health volunteer in the field and get to know about their progress. And apart from that, there is a weekly review at block level which is being conducted, and monthly review is also conducted by the district collector and deputy director on health services. As I mentioned earlier, women health volunteers are not part of the health system as such. So they are considered as volunteers and they are given honorarium based on their performance. So their performance is being assessed on these indicators. So number of households enumerated within the field, number of hurdles they have screened within their limited boundaries, number of adults they have screened for diabetes and hypertension, proportion of suspected adults confirmed diagnosis for diabetes or hypertension, and proportion of diabetes or hypertensive people on follow-up by WHV, and number of group counseling or patient support group meeting or other IEC activities which have been conducted by the WHV. So based on these performances, women health volunteers are graded, and based on their grades, their incentives or honorarium is being given. So this is one inbuilt monitoring mechanism to know where, to know on the process as such, on the outputs. So apart from this real-time monitoring using the portals and the reports that are being submitted by the WHV and DHN and the NCD district program officer, the government of Tamil Nadu also initiated certain interim surveys for looking at how this program as such is implementing. So John Hopkins Center was invited to explore the perceived barriers and perceived barriers and facilitators to screening and care-seeking behaviors with community members, NCD survivors, and healthcare providers. So their finding was IEC materials alone is not sufficient in addressing and reducing the NCD burden in Tamil Nadu. So, and their recommendation was to have a layered set of social and behavior change solutions for addressing the various needs of communities in preventing and managing NCDs. So, was there any action taken based on their recommendation? Yes, the state had come up with a branded campaign approach called as Nalam 365. This is a television channel specifically for looking at health related issues. Most of the videos, most of the content almost all the content which would be delivered in Nalam 365 would be on any issues related to health, and using this television channel, addressing the social and behavioral change communication solutions are being proposed. So this was one initiative following the survey by John Hopkins Center for Communication Program. And the directorate itself had their own interim survey. The Directorate of Public Health and Preventive Medicine, who is the primary implementer of this program, Makkalai Thedi Marthum, they themselves had a qualitative study done among different stakeholders, and they've also published it in the Tamil Nadu Journal of Public Health and Medical Research. And based on this qualitative study, they have identified the various challenges involved in implementing this program. They have, segregated it based on different domains like human resources, screening for NCDs, what is the challenge in follow-up, what is the challenge in delivery of drugs and dialysis bags, and what is the challenge in reporting, monitoring and supervision, and IEC and research. So this article also speaks about the proposed recommendations for overcoming those challenges. So the state itself, the directorate itself had done an monitoring and done a qualitative study on what are the existing challenges, and they've also tried to propose a solution. And apart from this, again, a third-party monitoring and evaluation was done by a National Institute of Epidemiology on the process evaluation. The objective of the NIE study was to find out what is the current status and functioning of women health volunteers. So how has the doorstep delivery of MTM services been reflected in the pattern of indenting oral hypoglycemic agents and antihypertensive drugs, and on utilization of health facilities among patients with diabetes and hypertension? What is the status of the linkage of information system under MTM with state population health registry? They use this framework of consolidation framework for implementation research. And based on this survey done by NIE, they have recommended to look at the input deficiencies. The survey identified vacancies in many places of WHV, and there were also a lot of, many number of people were not retaining in the services. So they suggested that this input deficiency has to be addressed, and they also found out that the WHVs were not adequately, they do not have adequate capacity on identifying or on exchanging IEC materials, and their orientation towards the NCD program itself was very insufficient. Based on their recommendation, again, the various stakeholders involved, Tamil Nadu Health Systems Reforms Project, DPH, and NHM, came with this flip book to train WHVs on the NCD, specifically on their task. So a flip book was created, and this flip book was used for training and retraining the WHVs on the NCDs. So based on the survey done by NIE, this was the action taken by the government of Tamil Nadu. So after this, the State Planning Commission, Tamil Nadu, they themselves initiated a survey on finding out whether MTM has actually reached the people. So they wanted to evaluate on the output. So far people had been looking at the process on the input, and now State Planning Commission wanted to look at whether it has actually given the necessary output that is required. So they looked at what is the proportion screened for diabetes and hypertension, what is the proportion of people who have been diagnosed with diabetes and hypertension under treatment. So based on their input, they found out that there was a huge urban-rural difference in NCD screening coverage, and there was also gender difference in the screening coverage. And among the various diseases that has to be screened under this program, cancer was covered extremely low, and people were not the proportion of people who have been informed about getting themselves to screen for cancer, cervix or breast itself was very low. So which indicated that the training on cancer screening counseling was very low. So based on this, the interventions were also designed. So men were targeted very less, because most of the time when women health volunteers reach out to the household, most of the men were at workplaces, and in urban area, men and women, the coverage was very low. So based on this feedback from the survey by State Planning Commission, it was decided a workplace intervention should be identified. So workplace screening. So occupation health centers have been identified, and in occupation health centers, again, through Makkale Thedi Marthuvam program, all the employees and employers would be screened for the common NCDs. And other screening strategies have also been employed in urban areas, apart from just depending on women health volunteers going house to house for screening for diabetes or hypertension. Other screening opportunities, like putting it on camp basis, using the other scheme which is already existing, like Varumun Kapum Thittam, or using under the CMCHIS, the insurance program, getting the private providers to screen on a camp basis in the urban areas. So other screening strategies have also been tried in urban areas. And again, strengthening on the WHV training for counseling on cancer screening was initiated. So far we had seen how the state has tried to look at the input, process, output, and the very idea of this Makkale Thedi Marthuvam program itself is to have a increase in the proportion of people who are under diabetes control and hypertension control. So currently the state is now going on with an interim survey to find out what proportion of diabetes or hypertensives are under control. And followed by next year, a steps survey round 2 would be undertaken to look for diabetes and hypertension control rate. So are these M&E mechanisms employed by the government of Tamil Nadu aligning with the principles which was elaborated by Mr. Rajeswaran? The relevance of the M&E monitoring and evaluation methods that have been adopted, they are highly, they are aligning with the goals and objectives of the whole program, Makkale Thedi Marthuvam program. Credibility of the monitoring reports. One thing is, if you look at the real-time reporting, there are multiple reports that are being collected within the program, but what is the utility of those multiple reports and how these reports are being converted into action is a question. The state has to depend on external monitoring and evaluation. A lot of dependency is there in external monitoring and evaluation. So the monitoring, the reporting which is happening within the program itself has to be strengthened. Regarding the transparency, yes, certain monitoring papers have been published in the journal, independence and impartiality. So the state has tried to involve other stakeholders who are not actually related to the program to monitor their input, they monitor the process and the output as well. Regarding the participation, all the stakeholders, if you look at the field workers, there has been a separate monitoring for the WHVs, for the institutions have been done, and whether it is utilized, whether any action has been taken based on the monitoring and evaluation which has been done. Almost all the monitoring surveys have turned into an action taken. Based on the recommendations given by the interim surveys which were conducted, an action has been taken by the state, and hopefully it should be adapting the monitoring and evaluation process should be it should be changed according to the needs of the program and the needs of the people as such. That's it. Thank you.
Thank you, Sudharshini, for that elaborate presentation on monitoring and evaluation of the Matheteri Maruthum program, and taking us through various measures that were taken in identifying various challenges of the program and how they have proposed recommendations and how it was addressed, and also finally giving us an overview of how it was aligning with the M&E principles that was mentioned. Thank you, Sudharshini. Now we'll move on to Vijay, who will talk to us about the ethical issues involved in monitoring and evaluation. Vijay?
Thank you, Sunu. Can you see my screen?
Yes, yes.
Okay. Thank you to SABC for hosting this interesting symposium. What I propose to do is quickly summarize the previous two presentations and flow from there into the ethics of M&E and certain considerations related to ethics of M&E. So the earlier Rajeswaran elucidated the basic principles and the procedures involved in monitoring and evaluation in public health, and he highlighted the various principles. And Sudharshini gave us a case study of the Makkalai Thedi Maruthuvam scheme in Tamil Nadu and how the government has taken various steps in monitoring and evaluation of this program. She highlighted the evaluation, the monitoring, the real-time monitoring that is available through the MTM portal and how that is used for making day-to-day decisions, and the evaluation that was done at baseline, the input evaluation that was done by National Institute of Epidemiology, which is an uninvolved third party, and then the process evaluation that was done by the State Planning Commission, which incidentally Sudharshini led that project. The State Planning Commission had commissioned her to lead the project on evaluating the program. And she also highlighted how the various steps in monitoring and evaluation of the Makkalai Thedi Maruthuvam scheme aligned with the basic principles of monitoring and evaluation. So this is a quick summary of what has happened so far. And moving forward, we will consider the various ethical issues involved in monitoring and evaluation. So for us to take this ethics discussion forward, I think the basic clarity is M&E. It has been established in the presentation thus far that M&E is a very essential step in public health. There is an ethical obligation to perform M&E. Why is there an ethical obligation to perform M&E? Because, like Rajeswaran pointed out, performing M&E is what is going to lead to optimal utilization of the inputs, and then proper conduct of the various processes and sustained and impactful achievement of outcomes. So therefore, M&E is an ethical imperative. So let us start with that in the background. And so in this presentation, I'll be talking to you about the various ethical considerations in M&E, and I'll propose a framework for ethical evaluation of a typical M&E project. Say if an M&E project is brought to the ethics committee for evaluation, a rough framework for how we go about evaluating the M&E project for various ethical considerations. So what are the various ethical considerations? I would like to divide them into certain substantial ethical issues and certain procedural ethical considerations. Like in any research project, by the way, there is a big debate. I'm not going to go into the details of that, whether M&E is research or not. That's a very highly debated topic. But I'll just throw some very, very preliminary light on that debate. One school of thought is that any data collection activity which leads to new knowledge, generation of new knowledge, which is generalizable knowledge, which can be classified as new knowledge, then that is categorized as a research activity, whereas all other activities which are locally relevant, they are relevant only for that project. I have a Makkalai Thedi Maruthuvam project and I am doing monitoring and evaluation of that project. The findings of M&E are relevant only to that Makkalai Thedi Maruthuvam project, then that does not get classified as a research activity. So this is a very debated topic in public health. But assuming that irrespective of whether it is a research activity or a public health activity, there are ethical considerations. There is a requirement for an ethical oversight of monitoring and evaluation. What are the various substantial principles or substantial considerations which are inherent to monitoring evaluation? Monitoring and evaluation has to necessarily do good. We already saw that there is an ethical imperative to do monitoring and evaluation, because monitoring and evaluation helps us to optimize the inputs processes in order to bring out effective outcomes. So that it is an ethical imperative, but there is also a need to make it scientifically sound, to make it robust, and to make it timely and actionable so that benefit accrues to the community. So that is the aspect of doing good. And then monitoring and evaluation should necessarily avoid harm. So by avoiding harm, it should avoid unnecessary physical harm, psychological harm, emotional harm, financial harm. Harm can be classified into so many types. So like in any research consideration, monitoring and evaluation should also try and avoid harm, inducing harm to the community and to all the stakeholders. Then justice considerations are equally inherent in M&E. There should be a fairness in selection of participants to participate in the monitoring, to participate in the evaluation, because there is going to be a sample on whom we are going to do the study. So there should be justice and fairness in doing that. And there is, of course, the consideration of respect to people, which comes in the form of respect to individuals' autonomy. So we are actually providing public health service to a community. Makkalai Thedi Maruthuvam did actually provide drugs at the doorstep, non-communicable disease drugs at the doorstep of the community. And now, just because I offer these drugs at the doorsteps, that does not give me the right to walk into the doorstep. I mean, walk into the people's houses and ask them questions and check whether this thing working or not. So there needs to be some respect to the individual's autonomy, respect to their time, respect to their conditions, and that should be ensured while doing monitoring and evaluation. Privacy and confidentiality considerations are equally important. There is a MTM national portal. There is an online portal for Makkalai Thedi Maruthuvam scheme. And this portal has reporting. It has reporting of the various beneficiaries, their health condition, their blood pressure, latest blood pressure levels, their blood sugar levels that were collected during the screening. So this is protected health data. And so there are obviously considerations of privacy. There are considerations of confidentiality of the sensitive health data. So needs for establishing data protection at the portal level. And all of these are substantial ethical considerations. When we come to procedural considerations, some of these have already been discussed earlier. Conflicts of interest. So usually when a program implementer themselves embark into the activity of doing monitoring and evaluation, what often happens is there is a conflict of interest. I am the implementer of the program. I design the program. I implement the program, and I also evaluate it. So there is an inherent conflict, and that's why the government of Tamil Nadu, they commissioned these evaluations to external uninvolved third parties. So that gives an extent of independence of judgment, and it avoids conflicts of interest to a certain extent. And then transparency and full disclosure. Again, this was again highlighted by both Rajeswaran and Sudharshini in their presentations. There is a need for transparency in the monitoring process. This is how the data will be monitored. These are the data that will be collected and uploaded into the MTM portal, the online site for Makkalai Thedi Maruthuvam. And this is the data that will be used for monitoring. And this is the data that periodically we will be collecting for evaluation. All of this information must be transparent. The community representatives must know that this is what is happening, and this is the purpose for which this data is being monitored and evaluated. Then there is this consideration of empowerment of stakeholders. When we talk about stakeholders, we talk about stakeholders at various levels. We are talking about stakeholders at the government level. So there are the ministers, the policymakers, the bureaucrats. They are all the stakeholders at one level. And then there are these people who are planners, the Department of Public Health and Preventive Medicine, who is planning this Makkalai Thedi Maruthuvam scheme, who is implementing it. And then there are people who are working at the ground level. That is the village health nurses, who are the equivalent of the auxiliary nurse midwives. And then we have the women health volunteers. These are the workers specifically drawn from the self-help groups, women self-help groups, and trained to provide community-based Makkalai Thedi Maruthuvam, non-communicable diseases services. So these are all stakeholders. And then the community, the largest stakeholder in this whole process is the community. And so empowerment should happen as a result of M&E. We just cannot constantly collect data from various cadres of people, use them for improving the program without that information being fed back to these stakeholders, and something being done to empower these stakeholders at various levels. So that is one procedural ethical consideration. Then, of course, accountability. The monitoring and evaluation program, there's a team which does this monitoring evaluation. They are accountable to the community. They forward accountability and upward accountability to the system. And then there is sustainability. M&E should consider the fact that these programs, the Makkalai Thedi Maruthuvam program, needs to sustain not just the program, but also the impact of the program needs to sustain. Sometimes sustaining the processes may be easy, but sustaining the same type of impact for the same process may be challenging. So sustainability is another consideration which the M&E should build into it. The M&E should constantly look for whether the program is going in a manner that can be sustained over a period of time. These are various ethical considerations, and keeping these basic ethical considerations in mind, we can now go and we can visit a proposed ethical framework. And this is a four-dimensional ethical framework that we are proposing. The first dimension of this framework is, first, we have to evaluate whether the monitoring and evaluation project, whether it has scientifically sound objectives, appropriate indicators, and methods of measurement. This is the ethics of the science of the M&E, and good science is good ethics. So if the M&E is robust and if it is based on scientific principles, then it leads into, it becomes an ethically robust process, because it gives rise to appropriate findings, and those appropriate findings help to make appropriate corrective actions. That is the first dimension. We'll look at these dimensions in detail in the subsequent slides. So that's the first dimension that we propose. The second dimension is, this has been variably referred to in the previous presentation. Sudharshini and Rajeswaran called it participation, community participation. This dimension is community and stakeholder engagement. So we'll look at in detail what are the advantages of having community and stakeholder engagement in planning, conducting, and evaluating the process, the M&E. So what is the role of community and stakeholder engagement? That is the second dimension. The third dimension is the basic dimension, which looks at doing good, avoiding harm, respecting communities, values of the communities. Those comprise the third dimension of the framework. And the last dimension is responsibility to the community. We are giving something back to the community and empowering the community. So that is the fourth dimension. We will look at how these four dimensions form a compact ethical framework for assessing the monitoring and evaluation project. The first dimension is scientifically sound and appropriate objectives, indicators, and measurement methods. Let us first look at the Makkali Thedi Maruthuvam example, and then let us reflect on the example. So in Makkali Thedi Maruthuvam example that was commissioned by the state government, State Planning Commission, and which Sudharshini led, some of the indicators were what proportion of the community have been screened for diabetes, hypertension, and cancers. This was one of the objectives. And for this, the indicator they used was out of all the people who are at risk, that is all the people above 30 years who are in that community, how many, that is the denominator, all people at risk above 30 years of age in the community is the denominator. Out of these people, how many people have been screened for blood pressure and for capillary glucose for diabetes. So this is an indicator, and this indicator will answer the objective proportion of the population, eligible population, who is screened according to the Makkali Thedi Maruthuvam program. And is this an appropriate indicator? Is this an appropriate method of measurement? Definitely yes, because this is a process indicator. Because the Makkali Thedi Maruthuvam has a process which is screening of populations in the community and therefore identifying new cases of diabetes and hypertension in the community. And that is what this indicator is measuring. And how did they measure this? There are several ways of measuring this. We already saw that the Tamil Nadu state government has a MTM portal. It has an online portal which has into which all the women health volunteers and all the various public health implementers are uploading data of how many people they are screening. That itself will give you the numerator and the denominator. How many people got screened out of how many people eligible in the population. That they could have done, but they did not just settle for that monitoring data. They also had an evaluation component where the people, the evaluators went door to door and questioned the people. They asked them, have you ever been screened? Has somebody come to your home, checked your blood pressure, checked your blood sugar by pricking at the fingertip? This was done. Why was this done? Because this will give us a estimate or an evaluation which is independent of the health system data. So that is very important to verify and validate whether the performance is aligning with what the health system is reporting. So the method of measurement here is appropriate. It is ethically appropriate because it is an independent third party who is actually going door to door and asking people whether this has been done to you, and not just relying on data that is reported in the government portal. So that is, this is how we look at how this monitoring and evaluation data is collected, and we reflect on whether this is appropriate, whether it will give me valid information. If I only relied on the data that comes from the portal, then I would question the validity of the data. I would question the validity. Now, if I also have an independent third party going to the community and actively collecting this data in the field, then I have validation of the information. So is it appropriate indicator? Yes. Are the methods of measurement appropriate? That also yes. And so when you talk about methods of measurement, it also depends on who have I sampled. Have I sampled the appropriate people on whom the data has to be collected? Or have I sampled only areas which are very close to a nearby urban, high performing place? Or have I sampled low performing districts, high performing districts? How have I sampled? That also tells me the validity of the measurements. And in this evaluation, which Dr. Sudharshini told us about, there has been a very, very rigorous multi-stage sampling at various levels using the Human Development Index of various districts in Tamil Nadu. They have sampled and they have interviewed the community members. And that gives us a more representative measurement of coverage of screening services. Therefore, under this dimension, we are looking at, are the right research questions asked? So for a process indicator, these are the right research questions. How many people have been screened? What proportion of people have been screened? What proportion of people have received cancer screening? What proportion of people have been started diagnosed? What proportion of people have been started on treatment? What proportion of people have received the medication at the doorsteps? These are all the right research questions, and they have asked all those questions. Then have they selected appropriate indicators? Yes, we have discussed it. And are the methods of measurement appropriate? That also we have reflected on. And is there community and stakeholder engagement in design? This is very important because when a third party, Dr. Sudharshini was talking to us about how Johns Hopkins came to do a preliminary evaluation and the National Institute of Epidemiology came to do an evaluation. These are uninvolved third parties. So when they come for evaluation, they have to sit down with the primary stakeholders, which is the Department of Public Health and Preventive Medicine of the Government of Tamil Nadu, as well as some community representatives, some women health volunteers who are implementing this whole thing in the community, and public health specialists. And that kind of stakeholder engagement in designing the the monitoring and evaluation program makes it more productive and makes it more meaningful. So that is the first dimension in an ethical evaluation. So I need to see whether it is good science, good research question, good methodology, and was stakeholder engaged, was community engaged in designing the M&E project. When I have all of these things, that covers the first dimension of ethical evaluation of the M&E. The next component is transparency and fairness of stakeholder and community engagement. So we'll briefly look at what is community engagement, what is stakeholder engagement, and then we will see how this enhances the ethics of an M&E project. Community engagement means now Makkalai Thedi Maruthuvam is a program based out of community to do the service, to deliver the services to the community. Therefore, community engagement is very important because the M&E team has to engage with the people to understand what are the indicators which are relevant to them. What are the indicators which will capture the effectiveness of the MTM program appropriately to them. Here, if you look at this indicators, these indicators are things like what proportion were screened, what proportion were diagnosed. Most of these indicators look like they have come from the perspective of a public health officer, a public health manager, because they are interested in these indicators. Now, what would a typical community be looking at? A community would probably look at, are women and men equally involved, or are women and men receiving these services appropriately? Are Dalits, Adivasis, and the other backward communities, are they all receiving the MTM services appropriately? These would be concerns of a community. And the community would also probably ask the question of, once the community, let us say these MTM Makkalai Thedi Maruthuvam volunteers are coming and doing these services to us. Now, when we get referred and go to the PHC, or when I am referred and I go to the district hospital, are the services there strong enough for me to go there? Or is it only happening at the community level? These are all obvious questions which a community would have. And unless there is community engagement, these questions do not come into the framework. Dr. Sudharshini pointed out how caste-based differentials, gender-based differentials were all captured in the evaluation of the Makkalai Thedi Maruthuvam program. And she also pointed out how urban-rural differences were captured. These all are important indicators which came in because of engagement with communities. They came in because communities find these as the most important and relevant indicators. So therefore, community engagement is important. Then stakeholder engagement. If a third party like the National Institute of Epidemiology decides to do a complete monitoring and evaluation without consulting or without engaging with the Tamil Nadu state government, they are probably going to have a very, very different set of indicators. But engaging with the Tamil Nadu government is what brought in. Okay, so engaging with the Tamil Nadu government is what brought in the appropriate. That's what brought in the appropriate indicators on board. So that is the importance of stakeholder engagement. Then when we speak about community engagement, what exactly is community engagement? Who is the community who needs to be engaged with? And that's again a very elaborate discussion on who is a community representative. Usually community representatives are usually the panchayat. Panchayat is the local self-governance bodies in all the village levels in India, and the community representative is usually somebody from the panchayat and somebody from the local self-help groups. These are the people who are usually community representatives, and community representation has to the representation of the community should involve people from all sections of the community. It has to involve the vulnerable groups. It has to involve different caste groups, it has to involve men and women and all genders. So that is proper community representation, and community engagement must have all these components in it. Then who is a stakeholder? Of course, all people who are involved, starting from the community up to the state government who is implementing and the policy makers and all of those other stakeholders like the website administrator, the supplier of equipment, all of these people, and the information technology consultants, all of these people are stakeholders, and they have to be engaged for the monitoring and evaluation to be relevant and ethical. And only if there is appropriate community and stakeholder engagement, there is going to be accountability. Only if we provide evaluation data that is relevant to the stakeholders and to the community and stakeholders are going to utilize it and do some corrective action to improve the program. And finally, empowerment is an important paradigm which we'll be looking at later. But community and stakeholder engagement is very important to ensure proper empowerment, because only if we constantly engage with communities and stakeholders, our M&E will empower the community and stakeholders. Next, the basic principles of doing good, avoiding harm. I'm not going to go into great details of this. Doing good, avoiding harm, and respect to research participants. Now, in this, we need to, one thing I would like to mention, which is unique to M&E, is we need to identify who are all the people or who are all the stakeholders to whom we have to consider doing good and avoiding harm. So the stakeholders here are multiple. First, there are public health program beneficiaries, which is the community. In case of Makkalai Thedi Maruthuvam, it is all those people above 30 years who are living in those communities. And then there are public health program stakeholders, the program managers, the program implementers, the program administrators. Then there are the public health program officers, program planners, So all of these people are at various levels. These are all people who are beneficiaries. They are participants, and we have to ensure that there is good and there is avoiding harm across all these levels of participants. One typical example is, let us say, during a typical evaluation of the Makkalai Thedi Maruthuvam scheme, if the program evaluator encounters a underperforming women health volunteer, a women health volunteer who is not adequately performing the assigned tasks, then this is an important finding, and this finding, corrective action has to be taken. So reporting her to her higher officials may land her up in harm. Harm in the sense that she may lose her job, because as Dr. Sudharshini pointed out, these are all volunteers and they are purely working on performance-based incentives, and they are usually overloaded with a lot of tasks in the community. And so this is the person, and for some reason she is underperforming. And when we report her higher up in the hierarchy, then there is possibility of harm. This is an ethical consideration. So this is not just when we are saying harm, it's not just harm to the community, but it is harm to all kinds of stakeholders across the board. And now another possibility could be the Makkalai Thedi Maruthuvam scheme may actually, let us say, they are looking at purchasing blood pressure equipment and the glucometers for checking blood sugars from by a tender process. They have identified a supplier, a manufacturer supplier, who will give the equipment. Then when these equipment and when all of these things come into use by the Makkalai Thedi Maruthuvam scheme, then local market, the local people who manufacture these or the shops which keep these, they may actually be harmed financially. They may not have business. They may not be able to sell their product. Is this really a very big issue? It may be an issue in a typical urban area where when this happens, when the supplier is different, then the local manufacturers, the local suppliers, they may all have issues. So these are all various things across various stakeholders may have benefits, harms, and risks. And all of these have to be considered. And then, of course, privacy and confidentiality protection for participants. This has already been described a little bit. We spoke about how monitoring and evaluation have identifiable information from communities that is collected. And this is stored in the online database. And so the data protection is very important. Data leakage, all of these things are important. Another important thing that often happens in public health programs is the need for linkage with Aadhaar. Aadhaar is the national unique identity number, which every citizen in the country has, in India has. So there is some need to link all health services with Aadhaar. And when there is linkage with Aadhaar, then that becomes an issue in privacy, because Aadhaar database itself, the confidentiality, the data protection systems that are available in Aadhaar, this has been a matter of controversy and has been a matter of debate in the Indian context for quite some time now. So that is another issue that needs to be considered. So these are all various considerations of doing good, avoiding harm to the research participants. And this is one dimension of ethics of monitoring and evaluation. And finally, the fourth dimension of M&E is responsibility to the community. Here, this can be broadly divided into 4 types. First is building local M&E capacity. Now, Dr. Sudharshini was mentioning that National Institute of Epidemiology came and did some evaluation. Johns Hopkins came and did some evaluation. And when these evaluations are done, not only do they provide recommendations for improving the program, they also train local people. They use local people or people within the program to do some data collection. What this does is, it improves capacity. So these local data collectors, the community health workers in the state, they are trained not just for data collection, they are also trained for ethical data collection. Say there is a training and capacity building on ethics. There is a training and capacity building on conducting qualitative interviews. There is a training capacity building on conducting surveys. So all of this is building local M&E capacity so that the M&E, the monitoring process, can be sustained in a robust and scientific manner. That is a ethical consideration. So what happens is when Johns Hopkins or NIE finish their evaluation and leave, when they leave the state government system, the government machinery has a sustained monitoring process which they can conduct in a robust manner because the local capacity has been built. And then there is sharing of data. So this again is very, very important because which has been highlighted by Dr. Sudharshini, that she said that at every stage, at the stage of Johns Hopkins evaluation, at the end of it, the data was shared with the stakeholder, the government, and they created a television channel, the Nalam channel, Nalam 365 channel, which specifically looked at providing behavior change interventions to the community through television, popular television channel. So that is sharing of data for local action. And then also sharing of data with community. In fact, if you look at the most recent evaluation that Sudharshini performed of the Makkalai Thedi Maruthuvam scheme, you can see that that data was published in the newspaper. All the popular newspapers in Tamil Nadu covered the findings of the data. Not only that, the State Planning Commission, the health in charge of the State Planning Commission, came out on television, popular television channels, and shared the information, shared the findings of this evaluation. This is very essential because the community is now made aware of what is the findings of evaluation, what are they going to change, how successful is this program in a very transparent manner. So sharing of data and findings locally is very, very important. And then whenever the M&E team provides the findings, when they make a report, they have to make sure that the report is actionable. Meaning, this is typically what Dr. Sudharshini pointed out. She said immediately after the Johns Hopkins team gave their evaluation, there was this Nalam 365 campaign. And then after the National Institute of Epidemiology gave their report, there was this flip book. They created a flip book and retrained all the women health volunteers. They did a refresher training. So all of these are actionable recommendations of evaluation, which led to some improvement in the program. So that is the responsibility to the community, making the findings of the M&E actionable. And finally, the M&E must obtain commitment from the program, from the implementers, to respond to the findings. Because if there is no action taken based on the M&E findings, then the M&E is moot. There is no purpose in conducting that M&E. Therefore, proper responsibility to the community would be to ensure that the stakeholders commit to corrective actions based on the findings of the M&E. So quickly recollecting the 4 dimensions, we can see that the 4 dimensions are scientifically and sound objectives, indicators, and measurements. Then community and stakeholder engagement in order to engage the communities, engage all the stakeholders in order to make the M&E process robust. Then doing good, avoiding harm, and respecting communities at different levels, different stakeholders, not just communities, but also other program stakeholders, and giving back to the community, having a basic responsibility to the community to ensure that the M&E leads to some actionable findings and the M&E leads to some improvement in the program. So this is a rough ethical framework for monitoring and evaluation in public health. And I'll share a paper which we wrote way back in 2012, in which we have covered this, we have presented this, the various dimensions of monitoring and evaluation in public health, the ethics of monitoring and evaluation in public health. That's it from me. Thank you very much.
Thank you, Vijay, for very clearly elaborating on the ethical considerations in M&E, particularly focusing on the procedural ethics, and also giving us the 4 dimensions of ethical considerations, and the very good and elaborate. And I think everyone would have got a clear understanding of that. Now I think we'll open the floor for questions or comments.
I see some questions in the chat box. Maybe we can take them first.
Yeah, the first one is some clarifying the difference between output, outcome, and impact. Yeah.
Maybe Rajeswaran can take the question.
Yes.
Thank you, sir. So, taking the Makalai Theri Marutham itself as an example, the output can be the number of women health volunteers trained. The outcome can be the number of community members that were screened for NCD and cancer components. The impact can be what is the blood sugar level control after the implementation of MTA. So these are the three differences between output, outcome, and impact, with MTM as the examples.
Okay, thank you. We also have a question. I think this is to Sudharshini. I think where the interim survey is the part of the monitoring of the
Actually, to begin with, only the process evaluation by NIE was part of the program. But the other interim surveys that were mentioned were ad hoc. I mean, depending on the need, depending on, based on the local challenges that they were facing, these monitoring, surveys were conducted. It was based on the felt needs of the public health system. It was not actually an inbuilt mechanism.
Okay. Okay. I think Vijay, we have a question to you, that is, please clarify the difference between research, M&E, and public health intervention.
Okay. The difference between research, M&E, and public health interventions. Okay. First, let me start by saying that there are a lot of commonalities between these three, and the commonalities are why we have this confusion between these three. What are the commonalities? One, we collect large-scale population-level data for all of these three things. Why do we collect large-scale data for public health research? Because it's intuitive. We collect data so that we can find the research objectives. In M&E also, we collect large-scale data because we want to monitor, we want to ensure that our intervention is working. So, but then what differentiates these two is the intent with which we are collecting the data. The intent with which we collect research data is usually to find generalizable common knowledge. Like, for example, I may want to find out which works better. Let us say I have a program for elimination of lymphatic filariasis. I have a mass drug administration campaign. I want to see whether the mass drug administration campaign, what is the best method of increasing the acceptance of this mass drug administration? Is it door-to-door counseling and canvassing, or is it public messaging through social media or public messaging through media? If this is the research question I have, I want the findings of this research question, I have to design it in such a way that the findings of this research question will be applicable across the board to whichever state which wants to do this, whichever country which wants to do it. It should be applicable across the board. So it is what is known as generalizable knowledge. So when I want to have a broad research question, when I have a broad question like this, which would lead to a generalizable knowledge applicable across the board, then I would call it research. Whereas if you look at monitoring and evaluation, the example for that would be an existing mass drug administration campaign for lymphatic filariasis in a country. It is existing, it is doing, it is performing. So every year on a certain day, all the people in the country receive the drugs. Now, to see whether how effectively this is working, how many people have taken it, then how effectively has it controlled microfilariemia. How effectively has it controlled lymphatic filariasis? That is applicable only in that country because it is looking at monitoring and evaluation of the performance of the mass drug administration in that country alone. It is locally relevant and it is not generalizable knowledge. One wouldn't take that information and use it anywhere else. It is locally relevant. This is one major difference between a research enterprise and a public health intervention, which is monitored and evaluation. Other differences are also being mentioned. One of the difference is since the data that is collected is applicable only locally, and there is a commitment that the information that is collected from this community will only be used for benefit of this community, and it will not be shared anywhere else, and that data will not go anywhere else. In monitoring and evaluation, there are certain understanding about how the data will be used, and therefore it is more local. It is more locally relevant and utilized. Therefore, there are a different set of ethical considerations for that. Whereas if the data is collected for research purposes, for generalizable knowledge, there is a possibility that a vulnerable country, say a developing low middle income country, is utilized for generating the data, but that knowledge never goes back to that country. It goes only to a rich country or a sponsor country where that information will be utilized. Those kinds of considerations happen when it comes to research. So those are some differences between what is public health research versus what is public health action with monitoring and evaluation.
Thank you, Vijay. I think that cleared the doubt. Another question that we have is like why some programs like the Sammakle Thedi Maruthum are evaluated by the government while some programs are not evaluated, like publicly funded health insurance programs. Is there some interest that the government has in doing certain programs and why not? And
if I can answer that, I think that comes from what is the greater agenda of the government. If I can see the MTM program being monitored, having so many surveys within a period of 2 or 3 years of its initiation, I think it is tagged with this World Bank loan. I mean, the entire Tamil Nadu Health Systems Reforms Project is based on disbursement linked indicators. Only if I achieve these indicators, Tamil Nadu government would be provided with a certain amount of loan. So therefore, I think a lot of monitoring and evaluation has happened because of that larger goal, I believe. I mean, with regards to publicly funded health insurance, there is no such greater motivation. I mean, this is on my complete personal opinion.
Absolutely. Thank you. Another question we have is like you mentioned that this NIE and etc. came in consultation with the Tamil Nadu government. They did the monitoring and evaluation, or they developed the indicators for evaluating the program. So whether it is unethical to have developed it without their consultation.
Thank you, Dr. Mala, for this question. Hi. Yeah. So the response to that question would be, if we did not have an engagement with the state government in Tamil Nadu, certain nuances of the program will not be known. Like, for example, what are the things that need to be, of course, there will be independence of NIE to conduct the evaluation the way they want, but the government who is implementing the program will have certain insights into what is going well, what is not going well. They may have some insights based on field experiences. They may have some thoughts based on why certain things are going well, certain things are not going well, and they may want answers for those questions from the evaluation team. So they will put this forward to the evaluation team and ask them to also look for this. The engagement with the state government is not to be just something that the third party will not just do what the state government asks them to do. That's not the kind of engagement. They would, in fact, engage to find whether there are specific issues that the state government are facing while implementing, which they need to be addressed, which they need to address during the monitoring and evaluation. That would be the scope of that kind of an engagement. And therefore, if they don't do that, it might turn out to be unethical, because they are doing something which the government may not be able to. The government has certain things in mind, want to improve on certain things, but that is not being answered by the MNE. That is why it would be unethical, I think. What are your thoughts on this, Dr. Mala?
Dr. Vijay, thank you for that explanation. Am I audible at all?
Yes, you're audible.
Okay. My connectivity is very weak. So what I wanted to add is it's extremely important to clarify on these multiple roles, because, and you did that just now, in order to avoid the potential for, someone to accuse the independent evaluator of, colluding with the government and therefore having conflict of interest. So that clarification becomes extremely important for, all of us, because we can jump the gun and look at it as conflict of interest instead of actually producing material that can actually be put back into the program as a corrective measure. And that, it's a fine balance. It's a very fine balance, a nuanced one that needs to be very carefully understood, which is why I raised that question.
Thank you, Dr. Vijay and Dr. Mala. We have another question, given this power asymmetries, because the government is commissioning this monitoring and evaluation, how independent is the independent agencies then who are doing this stuff?
SD, do you want to take this?
Sorry, I didn't get the question properly. I'm sorry. Can you please repeat the question?
Given the power asymmetries. Yeah, Sunu, go ahead. Sorry.
Yeah, given the power asymmetries, how much can a third parties be really independent when they evaluate the government programs?
To answer
is there really a power asymmetry? Is there really a power asymmetry between NIE and Tamil Nadu state government? SD, you should answer this.
There is no power asymmetry there, because NIA was invited by the government to do the survey. If NIA had to come do independently the survey, definitely there is an asymmetry, and it wouldn't have been easier, I guess.
And when independent, I think this question is from Raji. Hi, Raji.
Hi.
So,
yeah. So shouldn't it be better as a bidding or some kind of an open call for evaluations, and then the agency is selected rather than the government just picking one agency? Because even though it was, it seems like quite a bit of independence was given, in every case, in every other government, we cannot expect this to happen. So if the results are positive, obviously there won't be any problem in the publications and things coming out in the paper. But if the results were, say, negative, would we expect the same kind of transparency, etc.? Of course, Mala's point is well taken, is that right from the beginning, there's a engagement and a sort of a objective is to put in corrective actions, then it's different. But even the process of selecting the agency for evaluation, should we look at ethical implications there?
I agree with the point that you have made, ma'am. So there should be some bidding mechanisms wherein the government should be declaring that monitoring or evaluation is required for such and such program, and people should be submitting the concept note and the detailed proposal. But all the surveys that were conducted were not done on that basis. But however, within the government system, there is some program called as operational research program, at least.
Oh, great. Not married and sorry,
Okay. I mean, at least now government has thought of this operational research program wherein they are coming with certain important operational research questions, and it is, kept open for bidding, and people submit concept notes, and there is a separate team which evaluates the concept notes, and based on the, how well the concept note and the proposal is prepared, they are given grants for doing the survey. So yeah, I mean, I completely agree with you that it shouldn't be just on face value or based on the brand. It should be based on some real bidding mechanisms based on the concept notes and the proposals.
Dr. Vijay, Dr. Sudharshini?
Yes, ma'am. Yes, ma'am.
This is Mala here. Can I
Yes,
add
ma'am.
a word to that?
Please do, ma'am.
Yeah, see, the agency that actually looks for a report on monitoring evaluation, the government engages, you're saying, with transparency. But the question to ask is, who asks for that report? An independent evaluator's report, and usually it will be an external agency which is supporting it. So if money is involved in funding the program, then the funder could call for an independent evaluation. But the person who conducts that independent evaluation has many qualities, including the technical skill to do that, but also the credibility. And very often government institutions are again called to do that because of the credibility factor. And so one question to ask these kind of questions is actually the person who supports the M&E. That was an added response to what Dr. Sudharshini and others.
Thank you, Dr. Mala. Sudharshan. And Dr. Dasani, would you like to comment on it? You have mentioned something that comes. Dr. Dasani, are you there?
Hello.
Yeah, it's.
Sunu, are you having internet difficulties? Can I jump in?
Yes, please. Yes.
All right. Okay. So we have a couple of questions still. Dr. Jasani is making the point that monitoring and evaluation as a joint term, if you use that could be pretty much confusing. And some programs can exist without evaluation, whereas all programs are monitored. And then he poses the question, which I think is an open question. Aren't all evaluations of the programs when designed or done by definition research? Thus, when evaluation is done, all aspects of research, I think, should be applicable. To which I actually asked a connected question, and I think that's an interesting debate, is that then would evaluation projects also fall under the purview of institutional review boards? So Dr. Vijay, if you could take that, Dr. Jasani, if you're around, you could perhaps jump in.
I am here, but I think I have clearly written my question. So let there be discussion.
Okay.
You want me to elaborate on it?
No, that's fine. I think your question is very clear, Dr.
Yeah,
Yasadi.
I think question is very clear.
So Amar's point is that it is research because there is a design, there are specific objectives, there are rigorous methods for the collection of data, and there is analysis of the data to bring out meaning. Definitely, there is all activity that would happen in a typical research activity happens in M&E also. But therefore, it has to undergo the ethical scrutiny that any research project would undergo. There is no doubt about it. Amar has very nicely explained why that is so, because the various issues such as beneficence, non-maleficence, fairness in participant selection, then protection of participant data, confidentiality, all of these things apply even to any kind of data collection. Therefore, all those ethical considerations do apply, and therefore M&E projects must be passed through a rigorous ethical scrutiny. Whether it is research or not, Amar.
Sorry, I'm sorry. You can finish your stuff.
Yeah. So whether it is research or not is the matter which is often being debated. It gets called research. One school of thought is generalizable knowledge. So when that knowledge is locally acting, then it's not generalizable. It's locally relevant, therefore not research. When it is beyond local relevance, then it is non-research. It is research. The other thing is sometimes there is a lot of overlap even there. Sometimes monitoring and evaluation projects give rise to generalizable findings. They give rise to findings which can go beyond just that local context. There are a lot of learning from an evaluation project which can be applied across the board. So there are equally strong arguments on either side of the debate. It would be very interesting to hear what Amar has to say on this.
Yeah, Vijay. Yeah, I think what I wanted to say is that when we talk about the public health project or public health program, it falls in the realm of what you call public health ethics, right? And there is a framework, ethical framework for looking at the ethical challenges in any of the public health program. So you may have a program for delivering certain kind of services to the community. Now, all programs that you carry out in the community do not have evaluation. Like you have regular antenatal checkup, or you have immunization programs. They are not continuously monitored. They are continuously evaluated. So whenever there is a program, there is a monitoring. Monitoring you have to do simply because you want to find out whether your program is being implemented or not. That is what you say, that you have a process and you have inputs and outputs. Just look at that. How many times A&M went to the house? What kind of cases were identified? These are all things which are very simple, done on an everyday basis in any program. But their numbers have to be there in order to see that our program is working, right? All the dimensions, ethical dimension attached to that program are part of the public health ethics, framework that we have. On the other hand, when you want to design an evaluation of that program, it becomes very tricky, because in the formal one, you don't require any ethical clearance, from the ethics committee, because it's not a research, it's a day-to-day activity that is being done. And the monitoring is only in order to find out whether the activity is properly carried out or not. But when you come to the evaluation, you have a research question there. Is this working or not? Right? You want to find out whether it is making an impact or not. So that is what is in the first presentation, it was shown that you come to evaluation. So you have a research question there. It's an intervention research. It's like a clinical trial. It's an experiment. And it just cannot be done, in a good way, high quality way, without having a control group, right? So if you are designing it as a good evaluation, then you must have, from the very beginning, when you begin it, there has to be a separate evaluation team, which is, designing this research, while those who are actually doing program, they continue delivering the program. And then they also select a community which is for the control in order to find out whether it is working or not. So that is where the entire research component will come. And there you will have to, I think, risk benefit and all, absolutely correct. But what about autonomy, and what about taking informed consent? How will it be done in that kind of situation? I think that becomes very, very important. That is a question. It's like whether you will at the larger public health intervention project, simply because now it is because of the evaluation component that's converted into research. How will you be taking consent of both the community, the control as well as the. So it will have the similar kind of challenges as we have in cluster randomized trials. So this is this was what was my idea of asking this question, and that don't keep monitoring and evaluation as a one single term, but they can be separated also. Evaluation is not carried out every time you do monitoring. And when you actually do evaluation, you may be creating an evidence for your program, which can be used beyond the place where the program is carried out. As you said, that it may have certain generalizability, and then it becomes research. So that is the point that I was making. I don't know how far, what kind of change that will come in the ethics framework that you have presented because of this.
Thank you for these comments. If we do not have any more questions at this point, we would like to wrap up this event. But if we do have questions, that we're welcome. I mean, the floor is open. So I don't think so. Anyway, thank you so much to all the speakers today who shared their insights with us. And we hope that this was a useful session for all of you. And we hope to see you next month at our event. We have events every month. Some of them are internal, but majority are open to the public. Please follow us on Twitter. And thank you so much for joining in. Okay, so bye.